Hi, this is Fabio Graton with Farm Fresh TV, and I'm here at South by Southwest at the health track, and I'm here with Dr. Jen Dyer at the from Ohio State University. The Ohio State. And wanted to follow up with some questions about how you're using social media in your hospital and how you're using it with patients, and you're running an endocrinology practice, right?
Mm-hmm. So I actually use social media personally for many different strategies. So I do have a few friends that are my patients on Facebook. I mostly use Facebook personally, but I do keep in mind that I have some patients that are on Facebook with me, and the particular patients that are on Facebook with me, I communicate actually a lot with them, and they actually requested to be on Facebook because they wanted to cancel their email. And so I do mostly emailing with my patients.
Okay.
But
so not public wall discussions?
No, never.
Okay.
But these patients, they asked if they could use the Facebook email instead of their regular email, because teenagers don't like email. They like quicker things.
Because you deal with a lot of younger
Yes.
type 1 diabetics.
Yes.
And so they tend, Ed Bennett was telling me that occasionally your text will go off and they're sending you a message, they have
Yes.
questions, they'll send you their blood sugar.
Yes.
Wow, so and does that help? Have you found that that's increased how they pay attention to their health?
Yeah, I mean, really, health doesn't just happen between every 3 months in the clinic. So I don't find that my patients ever abuse this privilege of speaking to me directly and quickly. And I don't have all of my patients that are communicating with me this way. I've picked them very strategically because I think that they're the ones that would benefit from this. And I don't find that it actually takes too much time. It's very gratifying to be able to help them. I mean, honestly, why would I do it? It's because it makes me feel really happy to help my patients.
That's true.
But I use Twitter for advocacy, and then I use YouTube videos also for advocacy and teaching and trying to say the things that I say all the time, like in one place, because I literally say a lot of the same things all the time. So I feel that it's helpful to get it out there onto the internet space.
So you're using social media, you're using mobile devices. I've heard that you're maybe developing something new and exciting that maybe you could share with Farm Fresh TV's audience.
Yes, I'm actually developing an app in cooperation and partnership with a company in Columbus, Ohio. And we are going to be using it very specifically for diabetes and specifically for insulin-dependent diabetes. Going to be testing it this summer and testing the effectiveness of changing health outcomes, particularly hemoglobin A1C. It's based on B.J. Fogg's model and theory of health behavior change. That technology that allows you to increase literacy, technology that allows you to have a motivational component, and technology that triggers actually improves positive health behavior changes. So that's what it's going to be doing specifically, and allowing direct communication with the doctor and patient. It doesn't directly communicate to the health record, and it also stores all the information on an external database so that it's protected, and then all of the network of speaking over the Apple phone or the Droid phone is actually a protected network because it's not the internet.
Wow. So when might we expect to see this?
Well, I'm going to be testing it this summer, and I think this summer it will actually be available on iTunes.
Okay.
But the critical component of it is that it's a doctor-patient discussion.
Okay.
So you have to make sure that the doctors are on the other end, or it's not helpful. And so I'm going to be talking, if I show that it's as effective as I think it will be, then the next step is really getting doctors to be involved, and also getting insurers, because doctors, I'm doing this for public health, but doctors need to be paid for their time for this because
Right.
it improves health outcomes and because it saves lives and it really reduces costs.
Those are big, noble goals.
Those are big goals, but it works.
So any advice that you would give to Farm Fresh TV's audience, to other people out there that are in similar situations, where do they get started? You're obviously very knowledgeable about social media, very connected, and you have great partnerships. Not everybody does. Where does somebody start?
Well, I think, medicine is a very interesting field. Anybody that's involved in medicine, I mean, look how many TV shows are all about medicine. I think sharing information because it's helpful and something that you find helpful to yourself, to your family, to patients, that's where you start. And if people are always asking you about something because it's interesting,
Right.
well, maybe that's something you might want to share
Right. Something you might want to record, put on a YouTube channel.
because that could help other people.
Absolutely. Well, thank you very much. And again, we're here with Dr. Dyer at South by Southwest. And thank you very much from Farm Fresh TV.